Okay, let's unpack this. Did you know falls are actually the most common unintentional injury for older adults? It's pretty serious.
It really is. The numbers are quite stark when you look at them.
They are. Fall death rates in the U.S., they jumped 30% just between 2007 and 2016.
30%, that's significant.
And the CDC is forecasting, well, potentially 7 fall deaths every single hour by 2030.
Every hour.
Yeah. So this isn't just about a simple stumble. It's a major and frankly costly global health challenge.
Absolutely global, which is why the study we're looking at today is so relevant. It's from Beni Suef University Hospital in Egypt.
Right, taking us outside the sort of typical Western focus sometimes.
Exactly. And what's really fascinating here, or maybe critical is a better word, is the global aging trend. By 2050, something like 80% of older people will be living in low and middle income countries.
80%. That's a huge demographic shift.
It is. And it means nurses in those regions are right on the front lines. Their knowledge about fall prevention is, well, absolutely crucial.
So this study surveyed nurses directly. How many?
They surveyed 100 nurses, and the results give us some really valuable insights into what they know.
Okay, so what did they find? Was the knowledge level generally good, or were there gaps?
Well, it's a bit of both, as you might expect, but largely the majority demonstrated pretty strong awareness in key areas.
Like what, for example?
Okay, so for instance, almost 87% knew that weakness in the legs, the lower extremities, is a primary risk factor. That's quite high.
That seems pretty fundamental, right?
It is. And even more specifically, 89% correctly identified antihypertensive medications, blood pressure meds, as being linked to falls.
That's important, knowing about medication side effects.
Definitely. And they were also aware of practical safety stuff, too. Like nearly 89% mentioned providing adequate lighting.
Simple, but effective.
Very.
Yeah.
And over 92% knew to teach seniors and their families about preventing falls at home before they leave the hospital. That proactive piece.
That discharge planning is key. And did they know the common consequences?
Yeah, most did. About 79% knew broken bones were a main complication, and roughly 74% identified loss of balance as a major contributing factor.
So a solid base of knowledge seems to be there, understanding the risks, the practical steps, the
A
outcomes.
very solid base, yes. But the study also highlighted some areas maybe needing a bit more attention.
Okay, where were the potential gaps?
Well, for example, fewer than two-thirds of the nurses actually had information specifically on fall assessment tools.
Assessment tools. You mean like standardized scales?
Exactly, like the Morse fall scale.
Yeah.
Tools that help quantify risk in a structured way. Only about 59% knew about those.
That is interesting. Knowing the risks generally versus having a specific tool to assess them.
Precisely. And perhaps relatedly, over half of the nurses hadn't taken part in specific fall prevention training sessions.
Over half. So they have the foundational knowledge, maybe picked up through basic training or experience, but not specialized formal training or tools.
That seems to be the picture, yes. Which raises that key question, doesn't it? If the basic awareness is there, why the gap in specialized tools and training?
Yeah, what does that point to? Lack of access, time constraints.
It could be any number of things. Maybe training isn't readily available, or maybe the daily pressures on nurses just make it really hard to implement new protocols,
Yeah,
without dedicated time and support.
right. The reality of a busy hospital ward.
Or maybe even gaps in the nursing curriculum itself, perhaps not emphasizing these specific validated assessment methods enough. The core knowledge is there, but translating it into consistent, standardized practice using these tools, that seems to be the challenge.
So connecting the dots here, it sounds like the nurses have a really vital foundation. They understand the what and the why of falls.
They absolutely do. They recognize the key risks, the complications, many practical interventions. It's a strong starting point.
But the study suggests maybe we need to focus more on the how to systematically assess risk, how to implement best practices consistently.
That seems to be the crux of it. Moving from general awareness to applied, systematic prevention using all the tools available.
So what's the takeaway for us, for healthcare systems?
Yeah.
It seems like we need to think about how we can better support nurses.
Right, exactly. How do we empower them? Provide that accessible training, integrate these assessment tools effectively into their workflow, give them the resources.
Because ultimately, ensuring every older person gets the care they need to prevent a potentially life-altering fall, whether they're in the hospital or heading home, it really depends on bridging that gap between knowing and doing.
Absolutely. It's about making sure that strong foundation translates into the best possible, most consistent care for everyone.